The patient is unconscious. Electroshock has rendered them still. Their eyelid is gently lifted.
A slender metal instrument, sharp, narrow, roughly the length of a pencil.
It's placed just below the tear duct, a small depression in the orbital bone, right there.
A little resistance, then none.
The operator sweeps left, then right, severing the fibres between the frontal lobes and the thalamus.
Procedure complete. Time elapsed, 7 minutes. No anaesthetic, no consent.
You're listening to Psycho Killer, shocking true crime stories. We're about to delve into the mind of a man who delved into people's minds, literally. He called it a simple operation, a cure for madness, a gift to families torn apart by mental illness.
But as we heard at the end of part 1, Walter Jackson Freeman II performed that operation more than 3,000 times, and at least 100 of his patients didn't survive it.
He wasn't the first to perform a lobotomy, but he was the one who brought it to the mainstream, stripping away the caution, the surgical rigour, even the consent.
In this episode, we'll trace Freeman's fall from grace, the lives he shattered, the institutions that shielded him, and the legacy of silence he left behind.
And we'll also return in detail to the hair psychopathy checklist to see whether this crusading neurologist was just dangerously deluded or something even darker.
This is Psycho Killer, shocking true crime stories.
Episode 2, The Lobotomist, Power, Damage and Denial. Walter Freeman's career didn't end with a scandal or a trial. It ended with one fatal mistake too many, the lobotomy of Helen Mortensen in February 1967, his third attempt on her.
Freeman had first lobotomized Helen in 1946. She was among his earliest transorbital patients. A decade later, in 1956, a relapse led to a second lobotomy. By 1967, Helen approached Freeman again, believing it would restore health. But this time, she didn't survive. A cerebral hemorrhage. 3 days later, she was dead. The hospital revoked his surgical privileges, and he never operated again.
By that point, conservative estimates indicate that at least 100 of Freeman's patients had died. Other sources cite hundreds more. Some put his mortality rate nearing 14%.
So why did Freeman survive professionally for so long? Why didn't institutions or families stop him? The answer, early on, lobotomy was seen as a last resort lifesaver. As long as some patients showed improvement, or families reported relief, the backlash was muted. Other doctors raised concerns quietly, but they were drowned out by Freeman's charisma and press coverage.
Tensions between Freeman and his surgical partner James W. Watts grew over these methods. Watts was a trained neurosurgeon who believed lobotomy should be reserved, surgical, and sterile. Freeman's cavalier approach, performing operations without gloves, gowns, or proper hygiene, became too much for Watts to bear. He publicly expressed doubt, calling the methods untested and reckless, and left their partnership in the early 1950s.
Watts never minced words. On record, he said Freeman's method was more showmanship than medicine, and lamented that it often ignored surgical standards in pursuit of spectacle.
One particularly grotesque incident pushed Watts over the edge. While performing lobotomies at the Cherokee Mental Health Institute in Iowa, Freeman stopped mid-surgery to pose for a photograph with a patient on his table, the orbitoclast in place. During that moment of distraction, the instrument slid deeper and the patient died on the table. The victim's name? Unclear. But it became infamous. Watts later said that incident was among the final straw moments that drove him away.
Despite growing professional unease, questions from psychiatric groups, quiet refusals to host him, the medical boards were hesitant to act. There were plans for lawsuits, particularly after Helen Mortenson's death, but Freeman died himself in 1972, before any malpractice case concluded.
The organisation that banned him was the hospital where he performed Helen's lobotomy, Herrick Memorial Hospital in Berkeley, California. They revoked his surgical privileges, effectively ending his ability to operate. No National Medical Licensing Board prosecuted him, and no criminal charges were filed.
Freeman lived on for 5 more years. He travelled across America, revisiting former patients in an attempt to salvage his reputation. Countless had been left mute, incontinent, emotionally dead. Many were institutionalized, and as you'll recall, he recorded these visits in diary tapes, some of which we used in part 1.
And traveling around the country in a Cortez camper, in the past 4 weeks I've come 7,000 miles chasing up patients that I've operated on and saying how they are getting along now, anywhere from 2 to 30 years after their operations. There are quite a few of them scattered through the South, and I guess there's some 42 in Florida alone.
He encountered silence, empty eyes, lives lost or irreparably damaged.
By the time of his death in May 1972, the lobotomy had fallen out of favour. Antipsychotic medications like Thorazine had replaced it. The medical world recoiled, ethical standards tightened, and Freeman's legacy was one of infamy.
During our research, we stumbled on one of the darkest, least discussed aspects of Walter Freeman's legacy: the use of lobotomy to cure homosexuality.
According to Attitude magazine, Freeman was employed in the 1950s to treat gay men with psychosurgery, part of what was at the time considered mainstream psychiatric practice.
This isn't just fringe speculation. We found corroborating evidence indicating that Freeman's transorbital lobotomies were employed in institutional settings as conversion therapy, effectively viewed as a cure for being gay. Indeed, historical reviews note that Freeman performed up to 3,439 lobotomies across 23 states, many with his ice pick method, and researchers say it's likely some targeted gay men. However, records are scarce due to the stigma and the destruction of documentation.
In 1973, the American Psychiatric Association, the APA, removed homosexuality from its Diagnostic and Statistical Manual of Mental Disorders, the DSM. And you heard that right. Conversion therapies against homosexuality were standard in the United States until 1973. Lobotomy was considered an extreme extension of those practices, a surgical attempt to erase orientation by blunt brain disruption.
State and federal institutions were complicit, especially underfunded asylums that saw lobotomy as a way to manage patients. In overcrowded wards, patients became labelled deviants or disobedient, and they were easy targets. Institutional directors often welcomed Freeman's methods because lobotomized patients were quieter and easier to care for. One flew over the cuckoo's nest? Absolutely.
Okay, this won't hurt and it'll be over in just a moment.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it.
That's right. Just bite down. Now bite down on it.
Good.
Are you ready?
Here we go.
So while we can't name specific patients, the overlap between Freeman's peak years and the era of medically sanctioned conversion therapy makes this likely one of the darkest parts of his story.
Let's be clear, this isn't an addendum, it's a profound ethical failure at multiple levels: personal, medical, governmental.
State-run psychiatric hospitals, eager to cut costs and control patients, essentially outsourced moral responsibility. There was barely any objection because the victims were invisible, marginalised, silenced and unprotected.
That's how Freeman got away with it. His record keeping was poor, families rarely complained, and professional opposition was muted, censored or unpublished.
It's chilling to consider a man possibly lobotomizing gay patients while promoting choice and innovation, and receiving no professional rebuke until decades later.
Up next, the final arbitration of the hair checklist, as the bodies began to outnumber the successes. We've spent 2 episodes dissecting the life, methods and mindset of Walter Jackson Freeman II, the man who brought lobotomy to the mainstream. Now it's time to deliver our final assessment.
Let's start with a simple question. Was Freeman a serial killer?
Well, according to the FBI, a serial killer is defined as someone who commits 2 or more murders in separate events, typically driven by psychological gratification. But importantly, the motivation needn't be overtly sadistic. It can be clinical, compulsive, even ideological.
And that's where Freeman fits disturbingly well. He didn't kill in secret. He did it in the open, and he did it with institutional support. He had hospitals, nurses, orderlies, and for years, the press standing behind him.
And yet he left behind a trail of corpses, conservatively at least 100 confirmed deaths. Some researchers believe the number may be significantly higher.
And many of those deaths weren't tragic side effects. They were foreseeable, preventable. Freeman knew the risks. He pushed on anyway.
Which brings us back to psychopathy. We're using the Hare Psychopathy Checklist Revised, or PCLR, the gold standard. It evaluates 20 traits, each scored from 0 to 2, a maximum score of 40.
In North America, a score of 30 or more qualifies someone as psychopathic. In Europe and the UK, the threshold is 25.
So where does Freeman land? Let's look at the evidence. Glib and superficial charm. 2. Grandiose sense of self-worth. 2. Lack of remorse or guilt. 2. Callousness and lack of empathy. 2. Failure to accept responsibility. 2. Shallow affect. 1. Parasitic lifestyle. 1. Irresponsibility. 1. Poor behavioural controls. 1. Pathological lying. 1. And manipulativeness. 2.
That's a cumulative score of 17 or 18 based on the observable traits. But when you factor in institutional power, systemic enablement, and his long campaign of self-justification, that score climbs.
We conservatively place him between 27 and 30. In Europe, that's clear-cut psychopathy. In the US, it just scrapes or surpasses, depending on your point of view, the threshold.
But here's the kicker. Even if he wasn't a psychopath, he still fits the FBI's definition of a serial killer. Not a sadist in a basement, but a crusader with a medical license, killing people not in rage or lust, but out of cold, unwavering conviction.
A serial killer with a license to operate. A car he called the Lobotomobile, with a monogrammed ice pick and a trail of mutilated brains stretching from sea to shining sea.
In the end, the institutions that supported him didn't stop him because he was wrong. They stopped him because he'd become a liability.
And that may be the most chilling part of all. If this is your first time listening to Psycho Killer, shocking true crime stories, hit subscribe on your podcast platform of choice and never miss an episode.
A massive thank you to our Patreon supporters. You help us dig deeper and go darker. And if you'd like to join them and get early access, ad-free episodes and exclusive bonus content, head over to patreon.com/psycho-killer.
And stay tuned. Coming this autumn, our brand new short-form series, The A to Z of Psychopaths. Bite-sized profiles of history's darkest minds. Some you know, and some you've never heard of.
I'm Jack Morrell.
And I'm Simon Ford.
This is Psycho Killer, shocking true crime stories.